Welcome to our 5th session for personalized medicine implementation. Personalized medicine, an opportunity to redefine value in healthcare by incorporating patient preferences and socioeconomic aspects. So I think this is a really important session to discuss what is the value personalized medicine can bring to healthcare systems. I would like to remind you that we are having the session chat where you can enter your question, comments, and please do not forget to check if you are in the correct session chat. And then we are having, it's our last poll, our last interactivity session, but you will find on your right side in the interactivity button, you will find our question for the session that is, what is the most promising value, in your opinion, personalized medicine could bring for society or healthcare systems? So we are waiting for your answers. And well, it is my great pleasure to introduce the moderator of the session, David Harry. So thanks a lot. We see you a second time in this conference. And I would like to give a short introduction to David Harry, who has in fact so many hats that I chose one. He is participating in the European Patient Academy on Therapeutic Innovation, EUPATI, and through this is also involved in IMI. David is a part of our scientific committee, and I would like to thank you a lot for all your help in this process and developing this conference. Thanks a lot also for moderating this session. The floor is yours.
Thank you very much, Monica, for the kind introduction. First of all, I have a short announcement to make. Wiebke Löbke from Böhmer could not make it today. She has a COVID-related emergency. Anne Böhmer, who works at her institute, jumped in most graciously, presenting her slide. And we will also change the order of the presentations, meaning that Anne will speak first and Axel Mühlbacher will speak second. So to shortly continue about this session, and while we have it here and what we are going to talk about, healthcare systems are confronted with rising cost, fast technological developments, increasing number of patients with chronic diseases and expensive treatments. So this creates a difficult situation, and it is challenging for the ecosystem to guarantee an equitable access to care. And we are also confronted with different notions and different interpretations and views on what actually means value. And this session will provide some input from the view of health economists, national authorities, but also from data infrastructure to provide insight how personalized medicine will give value to the healthcare system in the future. And it is now my pleasure to introduce Anne Böhmer from Böhmer. She will give the first talk. She is involved in the project coordination of the STARS project, and she works at the Innovation Office at Böhmer. She's a colleague of Wiebke Löbke. Thank you very much, Anne, to have you here and giving the talk.
Thank you, Harry, and thank you also for this kind introduction. And I will just try to share my screen. Harry, can you guys just give me a short signal if you can see my screen? Okay, I see your thumb. Thank you. So then, yeah, thank you for the introduction, and also thank you for the organizers for giving us the opportunity today to present our project. And as Harry just already mentioned, today I'm replacing my colleague, Dr. Wiebke. My name is Anne Böhmer, and I'm also working in the Innovation Office at the Federal Institute for Drugs and Medicinal Products. And today I would like to present you our STARS project, which is a coordination and support action, and funded by the European Commission. And STARS stands for Strengthening Training of Academia in Regulatory Science. And so I click to the next slide. So here you can see an overview who is participating in this consortium. We are a consortium of 21 partners from actually 18 European countries, which are represented via their national competent authority and via the EMA. Plus we have 4 associated partners. And the coordination of this project is taking place here at the BfArM. This is my colleague Wiebke and I at the Paul-Ehrlich Institute and also in the DLR here in Germany. So the major goals of STARS are, well, first of all, we want to reach academic researchers very early in the planning of relevant grant applications. So we think that this is important because we think that strengthen the long-term regulatory knowledge in general by reaching out to clinical scientists during their professional training and qualification is a very important point in the journey on the drug development. And by this, we want to improve the direct regulatory impact of the results obtained in academic medical research. So you can see here that the academic researcher and the support of academic researcher in terms of regulatory knowledge is one of the major goals of STARS. So we are doing a lot of interaction with different stakeholders within this consortium. So first of all, we have a strong interaction with academia, both on the European and on the member state level. And we have a strong interaction with different funding bodies, with the industry, with stakeholders like patient associations and also other stakeholders. And all of these interactions come together. And during our project, which is taking on for now, we are in a second half, and it's a 3-year and 6 month project. We will have 2 stakeholders events, and we already had 1 stakeholder event. This was the first European stakeholder workshop, took place last year in November, and there we had 3 important aims. So first of all, we, the consortium wanted to go into direct exchange with the research community and the important stakeholders to analyze and also to optimize the successful implementation of the academic written research into the health system, because we think that here the regulatory aspect, of course, in early regulatory support is very important. So we got into dialogue between the clinical researchers and experts from the innovation and healthcare environment, and to further improve the knowledge and success of the research in the academic environment. And the stakeholder input actually is very important for the STARS consortium, because the input is planned. It will be important for the planned activities in the STARS project. And here you can see in this kind of speaking bubbles some important feedback from our stakeholders. For example, one first important feedback, and we also heard this in the sessions before, is that training of academic researchers is very important. So to have a kind of curriculum for investigators, which could be, for example, certified by the EMA or by clinical assessors. Another feedback was to have a kind of platform where academics and regulators are into contact to get into easier communication with each other. This was another valuable feedback. Also, this was that academics need a more general view on the regulatory process, and also to have a very early regulatory support was one statement. And we also all acknowledge that we need to raise the awareness of regulatory issues, because we all know that that drug development just not starts in the industry, but already starts very early on in the lab. And yeah, so we took together all of these input. So, and We will have a second stakeholder workshop where we go into more detail, and all this will come together into one common strategy, which will be established by the STARS project, but I'm coming to this later. So our project has a work plan, and we are working on these 5 different project outcomes, and I would like to just shortly walk with you through the different outcomes so that you can learn a little bit more about the project. So the first, our project outcome is a comprehensive inventory of existing support activity. So how did we go there? So at the beginning of the project, we started comprehensive surveys. And these surveys had the aim to analyze the status quo of existing support activities in the European landscape or the European regulatory landscape. We analyzed the survey data and did a comprehensive QM. And then last year, we launched a so-called comprehensive inventory on our website, which is there for the academic researcher. And this comprehensive inventory lists currently about 17 providers across the EU. So this is like a first, it gives you an overview about what is already there in existing support activity for the academic researcher. And it's a living document, so it might grow. And this is one support activity we directly offer from our consortium. So this is for you to get an idea how this comprehensive inventory looks like. So we have a different existing support activities, either sorted by expertise area or by support scope, listed by the countries, by provider type, support activity, and also give provider details. So it's publicly available on the STARS website, so everyone is welcome to have a look there. But with the STARS survey, we just not only asked existing support activities, but we wanted to gain a deeper insight into the current regulatory landscape. So we addressed these surveys to 3 different groups. So the first group was the clinical researchers and academic research groups, where we asked, for example, about awareness and knowledge about sources of regulatory guidance, and also asked about the challenges, what they see in regulatory matters for academic researchers and the training needs. The second group was that we also asked funding bodies about the requirements for project submission, on their perspectives on challenges, contact with authorities, and so on, and enablers and barriers in the linkage between academia and regulators. In the third groups, we asked the regulatory agencies in the EU and the EMA, and asking about their experience with academic researchers, and for example, the preparedness of academic researchers and non-industry researchers who request scientific advice in the agencies. So we took together, this is a huge data set we just gathered, and we can see a lot of different things coming up there. Because due to the limited time, I wanted to give you 2 examples here. So the first example from the clinical center survey, where we asked in which of the following topics the health researchers of your organization have contacted your unit and inquired about regulatory guidance and support, and how often this has happened. So here we can see that general matters and clinical study design actually were the things that were most often asked. So the general matters actually is one of the major topics for a research to go into contact the clinical center. And I would like to show you another example where we asked what is the most critical gap or deficiency in the current regulatory system. And here we had, so the most ticked answer, or the most given answer, was that we have a communication matter. So you can see here that the research centers and the research group, that the most frequently given answer that there is a lack of interaction and the deficient communication. And a second, that there is a lack of regulatory knowledge. So we clearly do see that there is a need for a better communication and a need for a better training on regulatory knowledge. And also we see that that there is for our target group that they see that there is a lack of specific support types. So And based on these data insights, we got from this data, the consortium is now working on a common strategy to improve these needs and to work on that. So one of our activities, how we also work on these obvious gaps, is that we are running different pilots to improve the support activities. And I would like you to show these different pilots we are doing. So the first pilot of our project is the so-called transfer of identified best practice example to another member state in the EU. So here we analyze the data and look where we have a good example and what would be a good example to transfer. And we identified here that there is an unmet need for a basic training on essential regulatory knowledge for researchers in the academic. So this was what most of the people, or what the majority of the people said would be a need. So we set up our pilot, and based on our data in the different countries, we selected so-called providers. These were our STARS partners from the Netherlands and from the Czech Republic, and established a best practice, which at the end was not a 2-day, but a 4-day regulatory training course, which just took place this week. And we transferred this course to the recipient countries within the recipient NCAs and clinical centers in Austria and Italy. So currently there is an evaluation running, and we had about 150 participants who took place in this training. So we already saw there, and also in the question, that there's a strong need for more regulatory training in academia. The second pilot is an initiation of a novel support activity, and also we found out in the data we got that one novel support activity could be a communication platform between regulators and academia, where also funder play a role. So that there will be, this is now currently in the planning, a one-stop shop for academic researchers. This pilot will be running in Spain. It is planned to run in September. And this is then our second support activity, or a second pilot that STARS will develop. Also here we will have an evaluation, and the insights we will get on this, or the feedback we will give on this, will come into our common strategy. So so this is this picture of the pilot where academic groups then can use this one-stop shop and can exchange with regulators and funders in Spain. A third outcome of our project is that we have published a white paper where we give the first recommendations that we saw based on the data. And what we did in this white paper, here you can see is that it was published last year in October. We identified a communication framework, and you see there are different players within this framework, and actually we identified different gaps. So you can see here within this red star, so there is a complex interplay between regulators, academia, and you can see here it's bidirectional, and there's also a lot of gaps. For example, the media, and it is sometimes difficult to find for the right information and to reach out to the right information, guidance documents, and so on. This is one gap. Another gap, it is the awareness of support activities who are already there and who are already there for academia or SMEs. So two other project outcomes which are currently more work in progress is that we develop a so-called core and another comprehensive curriculum. This will be also one activity which will be based on our data. And when we take all this together, the STARS consortium, together with Stakeholder Input, will develop the so-called common strategy, which is then the STARS roadmap for the planning and implementation on all the support activities and training programs. So in this picture, you can nicely see again, so the whole summary of the project. So we have along the academic career level, from a life science and our medical student, postgraduate, then to a research fellow, junior group leader, and then later to a principal investigator and group leader. You can see that we have the different activities targeted to the different academic levels. We also have the comprehensive inventory, which is of course is a great source for everyone who is interested here. And this also then, this at the lower bottom of the picture, you can see that how it's targeted the regulatory knowledge level, which might be already there. So to put it into a nutshell, so we have on the left-hand side, you see again the strategic concepts which we are developing out of our consortium with our partners at the European regulatory authorities and the EMA and the DLR. And on the right-hand side, you see the concrete and usual support measures we are doing and publishing. So all of them should at the end support the regulatory training for academia. We have a website where you can follow us and where we also publish our news. And with this, I'm at the end of my presentation, and I would like to acknowledge all the participating partners of the STARS project. It's a great consortium, and and I would like also to thank you for your attention.
Thank you very much, Anni, for the great presentation and for jumping in.